Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Apomorphine. Apomorphine is a non-ergot derivative. This apomorphine is used by a subcutaneous route, and this apomorphine is used mainly for the rescue treatment. That is, the apomorphine has freezing episodes are seen with this apomorphine. So, apomorphine is actually useful in rescue treatment. That is, rescue treatment is nothing but freezing episodes which are seen in levodopa induced dyskinesia. In this condition, in levodopa induced dyskinesia, for the freezing episodes, as a rescue treatment we can use this apomorphine. But the side effects of apomorphine can cause GI side effects like nausea and vomiting. It can also cause impotence also.
thank you and thank you for watching.